We have now marked 1 million lives lost to COVID-19 nationwide, and more than 2 years into the pandemic, Black Americans are still facing wide health disparities compared to other racial groups. A report by the Black Coalition Against COVID, released in March, breaks down how the Black community has been disproportionately impacted by the virus. Founder of the Black Coalition Against COVID and D.C.'s former public health commissioner, Dr. Tuckson, joins me live now for more on this two-year assessment. Thank you for being here, Dr. Tuckson. I want to go back to 2020, the height of this pandemic. In the report, The State of Black America and COVID-19, researchers found that Black Americans experienced a disproportionate number of infections, hospitalizations, and deaths early on. What are some of the factors that contributed to those disparities?
Three reasons in particular. Number one, because of the jobs that so many African Americans had, we are disproportionately on the front lines of care, of services. We're the ones that were so often bagging the groceries. We were the ones that are driving the metros and the transportation systems and so forth. We had the jobs that you couldn't do by Zoom or remotely. And so we were exposed. Number two, so many people of color are people who had pre-existing conditions. We knew from the very beginning that people who had chronic illnesses like lung disease, diabetes, heart disease, and so forth were particularly vulnerable to the first round of the first versions of the virus. We suffer from those diseases historically so much more often. And so you had that phenomenon as well. And then finally, we were certainly much more vulnerable to this because we didn't have the same access to the healthcare system as others did in this country. And that was another mitigating factor.
Now, your report found 1 in 310 Black children lost a parent or caregiver, compared to 1 in over 700 white children between April 2020 and June 2021. And in a recent study from the Langer Research Associates, 71% of Black people say they personally know someone who died of the virus, compared with 47% of white people. What do you make of these numbers, and why was COVID worse for Black Americans?
Well, this actually follows on to your first question. And one of the other big challenges that we in the Black community have is that we are living much more condensed. We're in the cities, and in the cities, we are living in multi-generational families. And so when others were perhaps able to quarantine, were able to do and follow the advice of separating out once you became infected and not infecting others, we had so many people who are living with grandparents, multi-generational families living together, sharing one bathroom. And so all of those were issues. And so when one person gets ill, others get ill rather quickly. And what we saw, again, for Black children in particular, is that their caregiving support network deteriorated so much more often than others. And this is going to have extraordinary long-term consequences for our young Black kids going forward.
Now, the report also says that Black Americans face discrimination and bias when seeking COVID-19 related health care. How did you determine that?
Well, what we found, for example, was early in the experience when we first got the life-saving vaccines, which have proven to be so extraordinarily important, there was a scarce supply at the very beginning. The mechanisms for disseminating those vaccines were often based on internet capabilities and the way in which local cities and counties organize the administration and access efforts. Unfortunately, people of color are disadvantaged in having access to the broadband technologies and the sophisticated use of computers to be able to interact with these public health systems. And so what we found was that we were less aware of the opportunity to become vaccinated early on. And what we also saw was, for the first time in many of our communities, white people coming into the Black community, playing the game well, and then getting the supplies of doses that people thought would have gone to those in need in the Black community. These are kinds of the infrastructure challenges, as well as we see in many of our state and county governments, less of an interest in caring about the lives of Black people. As we see now with voter disenfranchisement and many other political kinds of issues, the public health system is caught up in all of that. And so what we didn't see was a prioritization on those who are most in need, who needed most help. They didn't get it.
But Dr. Tuckson, 5 months into the vaccine rollout, your report found that Black Americans were less likely to be vaccinated compared to white Americans. And according to the Kaiser Family Foundation, as recently as this April, just 57% of Black people have been vaccinated. Part of that is attributed to a large amount of vaccine hesitancy in the community. So where is that coming from, and what interventions do you think can be used to try to help close that gap?
Well, I know we were short on time, but let me just say that what's underneath the data you just gave was originally we were behind, but the concerted effort of the coalition and many others, particularly Black health professionals, our 4 Black medical schools, the National Medical Association, Black nurses, along with Black pastors, all of them, and Black social organizations came together. We closed that gap, and we were equal in the first round of doses. Where we're now catching up again is on the boosters. And so our energy is totally focused on now getting Black folks to get boosted. But we closed that gap because of the concerted effort of the Black community deciding to take care of their own. And guess what? We did it.
Dr. Tuckson, glad to see your work paying off. I know a lot more is still left to be done, but we appreciate your time today. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.